Hi, I'm Megan Beeston. I'm doing my second video for week 3, and this is the axial skeleton. So the first on our worksheet is to name the cranial bones. So I have the frontal, the next one is the parietal, next one is the occipital, and then the external occipital protuberance is this little bump right here. And it says, what is this for? And it keeps the head upright and allows the head to tilt backwards. The temporal is right here. And the external view is the temporomandibular joint, which is the joint right here. Next is the mastoid process, is this right here. The styloid process would be right here between. The external acoustic meatus, this little indent as if the ear was there. And then the squamous part is almost as if it would be right here on the temple. For the internal view, we have the petrous part of the temporal lobe, which would be here. And it says what structures are housed within this part. We have the middle and internal ear cavities. The next is the internal acoustic meatus, so these little nodules. And it says what passes through the opening. And we have nerves and facial motor roots that pass through this opening. The sphenoid almost like it's right here. The external view is the superior orbital fissure, and that's almost like it would be back in there. And it says what passes through this opening. We have nerves, we have veins, and sympathetic fibers. And now into the internal view of the sphenoid, we have the lesser wing, which is up here, the greater wing, which is down here, the optic canal, and then the celiac tersa. I think I'm saying it, tersa. The question was, for the optic canal, what passes through this opening? And there are veins, arteries, and nerves. And for the celiac tersica, what structure fits in the fossa? The hypophyseal fossa creates the enclosure for the pituitary gland. Next is the ethmoid, and almost turn this way, a little closer. I was looking at my diagram, right there, ethmoid bone. The internal view is the crystal galley, and that bone is this thing right here. It's almost like a bump. And then it says, what does this do? And it helps to carry the brain into the cranial cavity. And then the cybriform plate which is almost like to the right and the left. And it says what passes through the holes. And the filaments of the olfactory nerves pass from the smell receptors into the nasal cavities to the brain. So next is the sutures. So we have, I'm looking right this way. Okay. So with the occipital bone back here, frontal here, we have the coronal surface, which would be right here. Then we have the sagittal suture, which would be right here. Next, we have the lambdoid suture, which would be this suture right back here. And then the next is the squamous, and it would be like here. Now for facial bones. Closer. First we have the maxilla, and then the alveolar process, the nasal, the zygomatic, and then it says what two bones form the zygomatic arch, the zygomatic process of the temporal bone, and the temporal process of the zygomatic bone. Next is the ethmoid. It's kind of like this internal nasal. And then the vomer would almost be like right below. And it says what two bones form the bony nasal septum? And it's the perpendicular plate of the ethmoid bone and the vomer bone. The inferior nasal concha is almost like it would be inside and to the side. And it says, what does this bone do? And it provides a rapid warming of air as it travels to the lungs. Next is the mandible. So this would be the mandible. And it wants the body. So we have the body. Next is the angle. So we have an angle here. Then the ramus would be right back here. Then the mandibular condyle, it's up here. And then the mandibular notch is right here. And then the coronoid process would be right there. Okay, next is the vertebral column. Turn this to around. Okay. So it says point out the four curves of the adult vertebral column. So the first one is the cervical curvature. The next one is the thoracic curvature. Now the lumbar curvature. And then lastly is the sacral curvature. It says which two are primary and which two are secondary. The cervical and the lumbar are secondary. and the thoracic and the sacral or primary. Next, the cervical vertebrae has 7, the thoracic has 12, the lumbar has 5, and the sacral has 5. The atlas is up here. It says, what does this bone articulate with from the superior aspect? So this bone is articulating with the head, or the skull at this point, and it supports the head, and it's responsible for nodding and rotational movements. So if I demonstrate this motion on myself, I can do this, and I can do this. Next, what is unique about the transverse process of all cervical vertebrae compared to those of thoracic and lumbar vertebrae? The unique thing about it is that it provides attachment for back muscles. Now for the thoracic vertebrae, we're going to point out something. So this is thoracic. These right here are the spinous process, and the transverse process are on the sides here. And then the intervertebral foramen, it's almost like it would be in between or almost behind the both processes. And it says what passes through, and the spinal cord would pass through. The body of the centrum, it's almost like it would be in here, inside. And then the position of the intervertebral discs, they're sandwiched between the bodies of the neighboring vertebrae. So, in between. The lumbar, so we just said the lumbar, and then the sacrum, and then this lumbar has 5, and the sacrum or the sacral has 5, and then the coccyx is right here. Next is the sternum. We have the mandibular, this part up here. Then we have the body and the xiphoid process. And then the jugular notch is right here. And then lastly we have the ribs. We have true ribs, false ribs, and floating ribs. So from 1 to 7, 1, 2, 3, 4, 5, 6, 7, we have the true ribs, and then 8, 9, and 10 are false ribs, and then 11 and 12 are floating ribs. And then it says to point out the head, neck, and tubercle of a rib. So the head would be closest to the vertebrae, the head, and then the neck would be right there. And then the tubercle would be almost like it would be on top, a little nodule on top. And I think that's it. Thank you for watching my video, and hopefully I pronounced everything correctly. Thank you.